Okay, we're going.
Okay, welcome everyone. I hope everyone's happy and healthy and safe and warm today. As we begin, I wanted to tell you that today our topic is of incredible interest. It's an impressive amount of humanity and personal dedication to two at-risk communities in our Lehigh Valley. I'm honored to introduce you to Nani Cuadrado, who has dedicated her life as a physician's assistant to both our homeless population and the community which has been so terribly affected by sex trafficking, two of the most vulnerable populations, which is difficult for many of us here today to even imagine. Nani is the daughter of Dr. Michael Sinclair, who was a cardiac thoracic surgeon and trauma surgeon at Lehigh Valley Health Network for over 30 years before joining Doctors Without Borders. As a child, Nani traveled the world with her hero, her dad, helping people within countries in crisis. She received a physician's assistant degree at DeSales University and now serves as an assistant professor teaching graduate PA students such courses as vulnerable populations, human trafficking, refugee medicine, intimate partner violence, and travel medicine. She has traveled the world on medical missions to El Salvador, Guatemala, Haiti, Honduras, Mexico, Nicaragua, Peru, Uganda, and Zambia. Ms. Cuadrado cares for the most vulnerable wherever they are, across the globe, on medical missions, or in our own community, on the streets, in clinics, soup kitchens, under bridges, and in local homeless encampments. She's also an expert on human trafficking and has trained hundreds of health professionals in how to help identify and care for victims of sex trafficking. This past year, Nani received an award from the Arnold P. Gold Foundation, which my daughter, who's a doctor, said is very, very impressive. And it recognizes and awards the infusion of the human connection into medicine. She was awarded the National 2020 Pearl Birnbaum Hurwitz Humanism in Healthcare Award. Even though she has traveled the world on medical missions, she has been quoted as saying, "I think the thing that is probably the most impactful for me is that I am blessed to be serving my neighbors." And we are blessed that her neighbors are here in the Lehigh Valley. Again, it's my absolute honor to introduce Nani Cuadrado, Director of the Valley Health Partners Street Medicine Program. Nani.
Thanks, Mary. I'm going to share my screen and then I'll rely on Terry to let me know if there's any questions in between. Certainly we can wait till the end, but if there's something pressing, I'm more than happy to answer questions. This is very laid back. So thanks for having me, and let me see if I can share my screen here. Okay, can everyone see the screen okay?
Mm-hmm.
Okay, fabulous. So welcome. My name's Nani, and I'm the program director for Valley Health Partners Street Medicine. All the pictures that I'm going to share with you really are from our community, are from the Lehigh Valley. Our team serves Lehigh and Northampton counties. And so this was actually one of my first patients with street medicine. She was living under the 8th Street Bridge in Allentown. So I'm gonna kind of go through what I expect we'll be sharing and learning about today. So I hope to discuss the impact of homelessness within the Lehigh Valley. I'd like all of us as a community to really understand the barriers our homeless have in accessing healthcare. I'd love to share the services that we offer through street medicine and appreciate some of the statistics of the work that street medicine is doing. And then also wanted to share how I might suggest a community member responds to someone experiencing homelessness. So a lot of folks have asked what street medicine is. And I think really folks think about this as something that's just local, but this actually is an international movement. And the whole focus of this work is to deliver healthcare where persons feel most comfortable. Many times marginalized populations feel very uncomfortable coming to emergency departments or clinics. One of the patients I just took care of just last week shared that she hadn't been able to shower for almost a year. And so there's quite a stigma attached with that. And so I think oftentimes folks feel more comfortable with us going to see them. This is a picture of one of our nurses seeing a young lady who's living under the Hamilton Bridge in Allentown. And so we were visiting her, and actually she was pregnant at the time and did not have prenatal care. So that day we brought blood work to do, and I brought a little Doppler with me. And so it was something that, again, we'd been trying to get her into the OB, but she felt that people made fun of her and said bad things behind her back. And so one of the things I think is super important is that we do see people where they want to be seen. So street medicine that I sit in actually is a beautiful blend of many things. We are not only partnering with Lehigh Valley Health Network, so that is my employer, but I'm leased to Valley Health Partners, which is a nonprofit organization. And we are in the process, we've just submitted our application to be designated as a federally qualified health center lookalike. And what that means is we'll hopefully with that designation be able to benefit from medications that are at a reasonable cost and a lot more partners that are supported by the federal government. So we're super excited about our space. And so, like I said, our particular organization, Valley Health Partners, sits between these three areas. So why do we even care about homelessness and health? The answer is really quite simple, although it's the right thing to do. If we look at the life expectancy of our patients versus you and I, because we are housed, can expect to live to an average life expectancy of 78 years old. But for somebody that's experiencing homelessness, that drops tremendously. And so I think the important thing that we think about is not only is it the right thing to do, but the average age of life expectancy for someone that's homeless is about 47. So that's a huge difference as far as who we care for and why we care for them. And this is a picture of working on our patients' feet. I have been trained by a local podiatrist to help care for feet and toes and toenails. And as you can imagine, if you're walking all day on your feet, they need a lot of love. And so this is us learning how to trim long toenails and really address sores on the feet so that we can make the walking not so difficult for our patients. So a lot of folks ask us about what the statistics are for homelessness in the Lehigh Valley. And so what I'd like to do is kind of start from the outside and kind of work our way in. The way the number is figured out, it's by something called a point in time count. And what that means is the federal government, HUD, will actually choose one night out of the week, one day, a 24-hour period where they decide to count persons who are experiencing homelessness. And they have a very rigid definition. So someone that's sheltered, someone that's staying in a hotel paid by somebody else, somebody that's living in their car or in the streets. So it's very specific. Our team cares for much grander than their space. So they don't consider, for instance, someone that is couch surfing as homeless, and we consider that. We decide that if you don't have a key to your own and it's not your own home, that in my mind is homeless. And so our team has also provides for folks that are couch surfing as well, which we consider homeless. And so the numbers are really just taken over a 24-hour period, and they don't reflect some of the lesser definitions of homelessness. So worldwide, thought to be about 100 million. I think that's a far greater number. In the US, about 500,000. And in the Lehigh Valley, according to the point in time count, they shared that there was a belief that 29 persons were experiencing homelessness chronically in the Lehigh Valley. That number, just to share why that is grossly inaccurate, about 5 years earlier, the Lehigh Valley Hospital did a study, and what they did was they interviewed persons who came to 3 different ERs, Cedar Crest ER, 17th Street ER, and Muhlenberg ER. And what they did was they asked persons about their homelessness status. And what it was found back in 2015 is that there were about roughly 7% of persons that came to the ER for care that shared that they were experiencing homelessness. Now that is greater than 18 just in 3 ERs and English speaking only. And that number extrapolated to 9,300 persons. So the work, I think, is probably somewhere in between persons that are acutely homeless and then, a couple weeks later are able to find housing. Obviously are being counted in that number, but I'll share some stats later that share that we're seeing about 1,600 patients a year, unique visits, and we see them more often than just once, of course. And so I think what I want to share is that I'm hoping that there's a better way eventually that can identify persons experiencing homelessness. The reason that HUD does it this way is that this is how they decide to share funding and distribute funding to the communities. Just like with the census, when the census is done, the number from that census is the thing that allows a community to receive benefits from the area when it's distributed. And with the point in time count, HUD, the Housing Urban Development, shares funding to help support persons who are experiencing homelessness in our valley. And so with a horrible number of 29, which we know is grossly inaccurate, we find that the funding that's being shared with our community is very low. And so I think this is something that I like to bring to the attention of movers and shakers, because I think there's a better way to be doing things. But right now, we're blessed to be doing this work, and there's plenty of persons to be taken care of that we know are more than 29. So the barriers to healthcare are many, and you and I can think about this and really understand it, but I do want to kind of share with some illustrations. So transportation, of course, is huge. When you don't have a home, many, of course, rarely have transportation. And so actually getting to an appointment, getting to care is difficult. When you don't have a home or a mailing address, you also lose your identification once it expires. So you actually need a mailing address with an address to get your identification. So if our folks have been bopping around and trying to survive, oftentimes when their identification expires, they can't find a replacement for it because they don't have a mailing address that you and I have that we can just recertify and send that in. And so what that also means is that there's no insurance. So in order to get Medicaid insurance, you need a mailing address. So if you don't have an address, then you can't get covered with medical insurance. So these are huge barriers for our folks. And then frankly, of course, there's a huge lack of trust. If they've not been able to shower and they feel dirty, they don't really trust that they're going to be treated fairly and with kindness when they come to our emergency departments or to a family doctor. And most aren't going to come anyway because they don't have insurance, and so they're concerned about incurring bills. So this is when we talk about transportation, I love this picture because this is my colleague Seth Campbell. And just to share how we work in a community, one of our community partners who runs the Bethlehem Emergency Shelter received a phone call from Barry, and Barry is the gentleman on Seth's back. And Barry had been walking at nighttime and tripped. He lives in the woods under the bridge and tripped and broke his leg. And so he was laying down below the bridge, unable to get help. And he called his friend at the church. His friend at the church called Seth. Seth went down to visit him, and we were very familiar with Barry because we visit Barry about every 2 weeks down under the bridge. But Seth, thank God he called Seth and not me, because strapping young Seth was able to put Barry on his back and help to carry him out to the side of the road where an ambulance was called. And he was able to get taken to the ER and then eventually get a cast But that became a huge issue because once he was stuck with his cast, it was very difficult for him to get around in the mud and in the dirt. So we did a lot of visiting of Barry just to make sure he was okay underneath once he returned back with his cast on. So again, just kind of sharing something simple that you and I think about really can be such a monumental barrier for our folks. I love this picture though. And like I said, thank God it was Seth and not me, because I would not be able to carry him out. What are the services that we share? So of course, because our goal is to deliver healthcare to the homeless of the Lehigh Valley, we have a lovely kind of array of services that we offer. Our goal is not just to deliver primary care, but to really deliver holistic care. And I think I'm very passionate about that because when, before I had this job, I worked for 17 years in the emergency department for Lehigh Valley. And I found that while I love the work and I love the pace, I felt very incomplete because I think that I managed to care for the person's complaint and the complaint only. If they came in for a rash, I took care of the rash, but I didn't look to find out why they have the rash. Is it because they're actually living outside and they're exposed to poison ivy? Is it because they're laying in a humid tent and they're in a wet space and that's why they have the rash? So what I found is that I was able in the ER to take care of just the complaint that was in front of me. But with street medicine, I feel I can offer more complete holistic care. And it's been such a gratifying way to provide services to our patients. So what that means is we have clinics that are on a regular basis. So we go to soup kitchens and shelters and we work on a regular, like every Tuesday and Thursday of this particular day of the week. Every Monday, for instance, this evening, I'll be working at the Allentown Warming Station at the Y, and that's every Monday evening, so our patients know that they can see us there. So we have clinics that are on a rotating schedule. And then Monday, Tuesday, Thursday, and Friday, we go on street rounds. And so what that means is for folks that don't feel comfortable being in a soup kitchen or living in a shelter, we go to them. So we go to visit local encampments, we go under bridges, as I showed pictures before, we go out into the streets, and we get to visit folks where they live in their home. And that's probably one of my favorite things to do. And so we usually do that, like I said, every morning, except Wednesday. We also have something called an inpatient consult service. And what that means is that in the Lehigh Valley, if a patient is identified as homeless, they will put in a consult. It comes through the computer, and we have the ability to connect with our patients before they're discharged. And why this is super important is that oftentimes our folks don't have a way of communication. Many do not have phones because you also need a phone to have, you need a mailing address to have a phone often, or you at least need money, even if you buy a burner phone. And so oftentimes once a person leaves the hospital, we have difficulty catching up with them. So this is a wonderful way to catch them before they leave, to find out what kind of services they need, to let them know about our rotating shelter clinics, and to let them know where they can receive services outside the hospital when they're out in the streets. And so this has been a really wonderful way to connect with folks. We also have a program that will be actually looking to, we've just finished spending money on this grant, but we have something called Respite Care. And what that means is it's acute recuperative service. And so if you and I were to get a gallbladder surgery, I'd be able to get that surgery same day and then go home, rest, and recover, and have my family take care of me. But what we found is that because our folks don't have a home, that oftentimes the surgeon isn't willing to do the surgery, not because they don't want to, but because our folks don't have a safe place to recuperate, and the rate of infection is very high if you're living outside. And so what we've thought about is well, what can we do? There are models of programs out in the country for homeless, where they either partner with a hotel, and that's what we did. So we were able to apply for a $100,000 grant through the through the Highmark Foundation, and we partnered with Extended Stay America in Bethlehem, which had kitchen suites, and then partnered with Meals on Wheels, and we were able to offer acute recuperative space for our patients. So they got surgery, and they went to the hotel to recover. We were able to order home health because they actually had a home where a home health nurse could actually go there and care for them. We also cut down on lengths of stay. So oftentimes, again, the hospital you might be too sick to go to the streets, but not sick enough to stay in the hospital. But for, again, you and I, we go home. And we recover in the hospital, we recover at home. But what our patients have found is that maybe they needed some time with wound care, or maybe they have an infection, and a hospital will discharge them, what we think is prematurely, because they're going back out to the woods. And so Respite Care allowed them to stay in a hotel and get maybe a few more days of antibiotics, get cared for, get some good nutrition, which also helps with the healing process. And so this has been just a lovely additional service. The idea was from 2019, December of 2019 through December of 2020, that we'd have the $100,000 to spend for our patients. And we predicted about a patient a week, so about 4 a month, because that was what we were seeing in the consults. But this was such a popular program, and once surgeons heard of it, they were super excited that they could actually help. And we actually went through the 100,000 by September of 2020. And so right now we don't have this program, but we're looking at ways to make this a sustainable program so that we can offer this permanently. And my dream is to actually have a building to do this, which is what a lot of services that are more established, like in Boston and in Pittsburgh, they have a respite program, but that will come in time. But right now, I just know that this is a tremendous need for our patients, and something that we're super proud about and excited to restart once we can get some funding to do this again and do this hopefully permanently. Another thing that started as a pilot but is now a permanent fixture in our program is something called telepsychiatry. As you may or may not know, getting to see a psychiatrist is super hard, not just for our folks that are homeless, but really for you and I. And it may take months to get in to see a psychiatrist. And that's really hugely difficult, especially during COVID. We found that a lot of the social services were stopped for our patients because frankly, people were scared. And so that left a lot of really stressed out homeless persons, and we had no way of connecting with them. So what we've done is we literally bring an iPad to them, because many of our folks don't have a phone. They don't have a phone that doesn't have minutes, there's no Wi-Fi. And so they can't do the virtual visits that many of us can benefit from. And so what that means is literally we have a behavioral health specialist that can do a telepsychiatry assessment, and we bring the iPad to them. So they don't need to have a smartphone, and they don't need to have minutes or a Wi-Fi, and we can help connect them to somebody who can listen to them, who can talk to them, and can help them get connected to services much more quickly than just making a phone call, which we know is an impossibility. Another thing that we're super excited about is, as I shared, the huge barriers have everything to do with the mailing address. And the hospital has agreed to let street medicine use the address for our patients. And this has been a game changer. So by having a mail service for our patients, they're able to get identification, they're able to get Medicaid, they're able to get government benefits like veteran benefits, all those things that they could not previously get, food stamps, without a mail service. It actually was funny because when I first started talking about it to our network, there was a lot of hemming and hawing by the mailman of our institution. But when I shared the ability for the hospital to now recoup Medicaid benefits, all of a sudden, it was a great idea because no longer will they have to write off persons that are uninsured, but now we are getting insurance and they're receiving reimbursements from Medicaid. So it ended up being win-win for everybody to offer our patients their mailing address. And so I'll share a statistic of benefits received a little bit later. But that was a super exciting benefit to be able to offer. And so that's something we're really proud of. So we bring the mail with us, we distribute it out in the woods, and it's really been a really great fun service because our patients are so appreciative of the work that we're doing. Care coordination is also very helpful. We spend a lot of time making phone calls on person's behalf, not just because they don't have phones and they don't have the time, but you and I all know too, our healthcare system is not an easy system to navigate. I mean, I just in the conversation I walked in on as you were having the discussion about COVID vaccination, how is somebody supposed to understand how this works? And like, where do you get COVID vaccination if you want it? If you don't have a phone, don't have internet, don't have TV, like where do you get this information? And so a lot of the work we do is helping to set up appointments, helping to get people information, and really working hard to connect them to specialty services if they need it. And this has been something that we're all getting quite good at. That was definitely not my training when I went to PA school, but I'm getting very good at the social work part of this job. We do a lot of survival support, and I'll show you some pictures a little bit later. What that means is persons that are living outside need things like jackets, gloves, socks, underwear, tents, tarps, sleeping bags, things to survive outside, which is something that is less than ideal. It's something I'd rather not be supplying. I'd rather have them have a home, but it's something that we need to do. And water, of course, because water freezes now if you're living outside. And so no one has fresh water nowadays. And then lastly, this is within the past year, we've been offering free pet services, not because I'm a vet, but because we have great community partners. We partner with No Nonsense Neutering, and we partner with the Lehigh County Humane Society, and they have been blessing our patients with free vaccinations, free neutering services, free sick care. And if our patients get housed, they will actually give them a free companion if they want one. That's perfectly, it's perfectly, I think, married with what we do, because what we found is that oftentimes the companions are their sole social support. And so it's super important for us to support their support. And so it really became very obvious to us that a dog might be not only support but might be protection while living outside. And so we found it very important to continue, if we could, to support their only friend, if that was the case. And so this has been something fun that we've really added to our services that I truly enjoy, because I'm a pet person. And this is Oreo. That's our little buddy Oreo. I could spend all day showing you pictures of my favorite pups and cats, but you'll get to see Oreo today. So some statistics that I wanted to share. Last year, we had 1,649 outpatient visits, and these were just unique patients. So we had about 2,200 patients that were duplicates, but about 1,600 unique patients. I did include, not in this stat, but we occasionally, before we had our relationship with the Humane Society, we've occasionally had to work on some four-legged patients. One of our patients had a retriever that had walked outside because they do so much walking, and got the pads of his paws torn up and burnt because the macadam was so hot. And so that poor pup was struggling because now he was in the dirt and could not walk or go to the bathroom. So we had a lot of gauze, and we just wrapped up the paws and then put socks over the paws. And so we've really enjoyed getting to care for all the needs of our patients. And like I said, that isn't just diabetes and blood pressure, but also their support animals as well. One of the things I wanted to kind of, as I talk about diabetes, I wanted to kind of also bring to mind something that I didn't think about until I was outside. If somebody has diabetes and they're on insulin, you can imagine that without a refrigerator or without a way to keep insulin from freezing, this is almost an impossibility to be a well-controlled diabetic on insulin. So a lot of our patients don't take anything because they can't take insulin. So not only do they not have a place to refrigerate their insulin, which is where it has to be, but in the winter, on days like today, it'll freeze, as do all of the inhalers. So all the inhalers for asthma and COPD, we don't think about it because most of us don't have to keep an inhaler outside, but all of the inhalers freeze for our patients. So we have to instruct them to keep them close to their body, to keep them at room temperature, at body temperature, because then if you're an asthmatic living in the woods and you have a frozen inhaler, it's not going to help at all. So something to think about. Of the inpatient consults, we had 325 that we did. And with that mailing address, we've been able to recover 156,000 benefits for our patients. And that's food stamps and Social Security income and rent income. And it's just been exciting. So this is something that obviously in just 1 year, we found this incredibly beneficial for our patients. So how do you respond to somebody that you see out in the community? If they have a health need, if you're a medical personnel, then you obviously take care of their health need. But share about what street medicine does. This is my work cell phone, so feel free to put it in your own phone and call. If I've pledged my patients that if I am with another patient, I will not answer my phone, and so that I can give my patient that's directly sitting in front of me undue attention, or the attention that they're due. And so, but I will get back to you. So that is my cell phone, so that you can call if you see somebody that's in need. And then I think lastly, just to wrap things up, I wanted to just kind of take you on rounds with me and show you a couple of pictures of some of the areas that we go to, and just kind of share that with you. So this picture on the left-hand side is near a bridge that got flooded. It's right behind Central Catholic. And so there's a little wooded area on the creek. And so this was a couple that we found that was living outside, and that's Seth, our provider, seeing to him. The picture to the right is underneath the Fahey Bridge. And so there's a little encampment. There's a couple living there, and then a single guy that's living there. And so it's kind of a sandy area, but it's one of my favorite places to go because they have gotten quite passionate about feeding the geese and the ducks there. And so every time we go there, there's probably at least over a dozen ducks and mallards that are kind of back and forth and have kind of become their pets there. So it's kind of a fun place to visit because they've got nice wildlife to enjoy. I wanted to show a couple pictures from the most recent snowstorm of our team. While we follow Lehigh Valley Physician Group rules, and what that means is if they cancel clinics, then we're not allowed to host clinic. And so I wasn't allowed to go to the warming station, the shelter for clinic. And so I asked permission from our administrator if we could go out and help, not necessarily see patients for medical reasons, but to help shovel out our patients who were worried about snow collapsing their tent, and then worried about them getting in trouble out there. So that we did get permission on Monday and Tuesday to get out. Only two of us have four-wheel drive vehicles. So Seth picked up his team, I picked up my team, and then we went out and just brought shovels and just hiked out to where people were and shoveled them out to relieve them. And I think every single patient was just so happy to see us because they thought for sure that we wouldn't be going out with the weather. but, and they of course had broken shovels that weren't working. So this is just some pictures of us shoveling folks out to get some of that weight off so that the tent poles don't snap under the weight of the snow. Joey on the left, that was him. He was actually singing and jumping for joy that we got out to his encampment, and we were just starting to get some of the snow off his tent. But that was a super exciting day for him. We heard him singing and his music, but he was he had no shovel. He was just using his hands to take the snow off his tent. And then on the right, we decided he had just been put on some blood pressure medication. So Doc is the name of our patient, but he had just decided, could you take my blood pressure, Doc? Because he said, I'm not sure if this medicine's doing any good. So I had Patrick take his blood pressure just to make sure he was doing okay, and he was. And that's just a picture of one of the encampments without the snow, just before it started. But I've put my cell phone there again. I've put our nurse line down and also my email address so that you can connect with me. But I just thought this would be a great time to see if there's anything I can answer. And I just appreciate your time. Thanks for your interest. I'm going to stop sharing so that I can see everyone's faces. Okay. I see something in the chat. It says, can you text the answer? Haynes donated socks to my church. Would you accept them? Absolutely. So I'll let Jan know, or someone can let Jan know that socks is one of our most popular items. Okay, they're pretty much disposable, unfortunately, because no one has running water to wash their socks. And so oftentimes just keeping fresh feet is super important. So socks are always welcome. So thank you to Jan. Any questions or comments?
I had a question, if I may.
Sure.
My understanding is that CACLV participates in the annual homeless census. And I don't remember them ever coming up with 9, a figure that low. And I'm trying to figure out how it could be. I mean, have you ever used CACLV's numbers, or are they not qualified in the HUD definition?
No, CACLV is actually one of the community partners that helps to do the census. So they actually will, that number, that 29, is for chronically homeless, rough sleeping. So they're not counting people that are sheltered. And so in my mind, if you're homeless and sheltered, you should still be considered homeless. But they're counting people that are rough sleeping outside. And so that's where that number comes from. So that was chronic outside sleeping or rough sleeping persons. That's not including the shelters. The shelters are, the Allentown Warming Station has 60 at capacity. Bethlehem Emergency Shelter has about 60 at capacity. And those are just temporary for the winter. So those numbers for sheltered persons are much, much higher, but that's unsheltered. Good question, Joyce.
Yeah, I have a question.
Sure.
I also see that the Erdmans have their hand raised in the participants. So I just put in the chat, I used to volunteer at the Bethlehem shelter. We had a facility at our church, at the Unitarian Church, which of course now it had been moved, but we continued doing a Wednesday night showers and a meal or snacks and laundry facilities so that people could come in and have their laundry done. Is there any place that does that? The homeless? I mean, obviously now we had to close, but.
New Bethany still has days that folks can do their laundry and go to the bathroom. But one of the things that has happened with COVID is that a lot of our community partners aren't allowing people inside. And so they're continuing to give meals to go. And so that means they're not allowing persons inside to use the bathroom, but now you can sign up first for time slots to do that. And so I'm not aware of any other places that have laundry facilities except New Bethany. And there's a group called Oath in Allentown, Operation to Address the Homeless. And they have laundry that they'll help folks. They're on 7th Street in Allentown.
Yeah, because they used to come in and, you know, we would do multiple loads of laundry for them. We only had one machine and dryer, but I don't think, I mean, I know we weren't doing it after COVID started. But
yeah, that's been a huge issue, Kathy, because once COVID has really changed a lot of the community offerings, because folks are worried about how COVID is transmitted. So showers have stopped at a lot of the places. And so that's what prompted me to ask my patient, like, when's the last time you showered? And it's been a year for her. And so I think Oath offers showers also, but they're limited time slots. And so there's not a lot to offer for there in New Bethany.
Does the Y, they have the warming station, do they let them use the showers?
They did last year, but not because of now that with COVID, they do not. So they used to have it, and they had it in a different area. So they had a space next to the locker rooms where they would have it every day that you could take a shower, but now they have no showers that are offered because of COVID.
All right. Okay. Thank you.
Yes, thank you.
Go ahead, Bill.
Nani, I'm curious. I saw I think it was a special on TV. It may have been in Los Angeles, doesn't matter. It was an adjunct to a street health program where they were doing surveys, and they determined that there was a core group of homeless people that were chronically homeless as opposed to transient. And the program involved them actually giving them keys to apartments. And they said that in that situation, and once they had, as you said, a place to live, a mailing address, and all those kinds of things, and they focused, and they said that was a relatively small percentage of the entire population. I don't know if that's something CACLV is focusing on, but I found that to be an interesting approach to the problem.
That's a good thought. There's something called Housing First model, and that's what they're basing that on. So the Housing First model is a model that says that if you house somebody, then you can work on supporting them afterwards. So for instance, they don't need to have their mental health taken care of before they get housing. If you house them first, then you can work on their mental health issues. Right. The problem that we found with the Housing First model is that there's literally no housing available in the Lehigh Valley. So the Conference of Churches helps with housing, but you actually have to have housing available for it to work. And so literally the Lehigh Valley has no affordable housing. And so that's what suffers. All the fancy apartments, I can't even afford the ones that they've just made in Allentown. Right. That like Symphony and all those, just all the ones that make the whole Allentown look beautiful. I can't afford those. And so I think that model works beautifully when you have affordable housing that landlords are willing to put their places into that pool to house people. Right now, we have no landlords that are willing to put their spaces because there are none available. Most folks, I think they'll probably be once the moratorium on leases is lifted and folks now get booted from their apartments. We're going to see a huge influx of homeless and persons that get booted from their places. But right now, and then there'll be availability of not permanent homes, but at least places to rent. But you also have to have, what they're not saying in that model is that you also have to have a source of income. So they're not putting people in it for free. They're putting people in it that have a source of income, whether it's SSI or SSD, so that you can afford to pay the rent after you put them in it. They might offer, in some of those Housing First models, they might offer 3 months for free, but then what happens after 3 months? And so then I think they're hoping that you'll get a job and then you can afford to pay your utilities, but there's a lot of caveats that are not really saying about that model. And I think that's a tough model because you need to have a source of income in order to stay. And you have to have affordable housing, which the Lehigh Valley does not. And so that's something I'd love to see some of these older buildings converted to affordable housing that people can actually live in and afford. Lehigh Valley is actually one of the worst places in the country with the lack of a pool of affordable housing. It's pretty brutal.
Yeah. Thank you. And by the way, thank you for everything you're doing for the community.
Oh, it's my pleasure. Good questions.
Go ahead, Barb.
I echo Bill. Thank you very much. This is an amazing program, and you're amazing. My question is, where can we donate warm winter outerwear?
Our house right now, so two things are happening. One is we are a little bit limited on a place to store clothing. So what we've asked people to do, because the hospital is a little picky now with COVID of accepting clothing, even if it's new, they don't know where it's at. And so I think they're being very picky about allowing things to be donated that are things. And so what we've been telling people is like the socks, I will look
Gloves.
the other way and not tell my bosses that socks are coming in, because otherwise they'll say no to the sockses, but I'm going to take the sockses.
Okay.
But what we're asking people too is if you're thinking about it, then I'd almost say gift cards to Walmart or Target or Amazon are helpful, because then we can get many different things. If someone needs a tent, we don't ever give them the gift card. Our patients, we actually go buy it ourselves and then bring it to them. And so that allows us a little bit of flexibility. If someone needs a case of water, we can order a couple cases of water on Amazon. We can order toilet paper on Amazon. So we order a Walmart, we can get tents. And so I think what I've been asking people just to be compliant with the hospital is to consider a gift card drive, because that way it gives us as a team flexibility to buy things that somebody needs. I have a guy that's a 5XL and nobody is giving us a jacket that will fit him. And so I had to order one on Walmart to get one for him. So that to me is the beauty of flexibility with gift cards, if at all possible.
Thank you for the information.
Sure. Thank
Nani,
you.
I have two questions.
Sure.
First question is, how has COVID hit the homeless population?
That's a great question. So COVID has hit the sheltered homeless. And so folks that are crammed into spaces where they're having to be on top of each other, even with COVID guidelines, that's where we're seeing COVID. I'm going to knock on some wood, but there has yet to be COVID in our unsheltered population, the folks that are living outside. The inside sheltered folks at the rescue mission, at the Bethlehem Emergency Shelter, they are getting COVID like crazy. And I can hardly, it's not the shelter's fault. It's a combination of many things. The shelter has set up beautifully to honor the way the CDC recommends shelters to do so. But the issue is our folks are terrified of telling the truth. And so when they go to the shelter every day to get screened, if they feel like they're sick, they won't say that they feel sick. And they may be afebrile, or maybe they just pop some Tylenol before they went so they don't show a fever. And so because they're afraid of not getting into the shelter. So what's happened is folks that have been probably positive have been able to get by the screening process before they come in. And again, I can't fault them for that, because they just want to be sheltered. And so they're not being honest about their symptoms, even though they know it can shut a shelter down. And that's what's happening. We just had 16 possible positive, 16 that went for COVID testing, which is a nightmare because they can't return to the shelter until the COVID tests come back. And so we do have a program where it's a COVID quarantine that they go stay in a hotel until the results are back. But it's still a nightmare because it's up to the municipality of that person to pay for it. So it's not a street medicine thing. The municipalities have gotten money to help to house persons who are homeless while they're waiting for their COVID quarantine tests. And again, that's provided that they've even shared that they're homeless. If they go to the ER and the ER doesn't ask if they're homeless, they'll do the test and then send them back outside to infect everybody else. And they can't quarantine because they have no place to quarantine. And so it's kind of a really hot mess right now because our patients are scared and they don't want to be honest. And so I don't blame them at all. I think I probably would lie too if it meant being warm or, having a tickle. And I think the problem is that also that I'm going to bring this up because I keep reminding the shelters, this only works when people are symptomatic. There's not a lot of great data, and I can guarantee you that it's still spread when you don't have symptoms. And we're missing that completely because the screening process for each of the shelters is screening only for people that have symptoms. But it's been proven that people are spreading it when they're asymptomatic. And so we're really relying heavily on somebody to have a fever or a cough or what have you. And if they don't have those things, that doesn't mean they're not spreading it, just means we're not screening it. And so I think this is a really tough time, which is why I can't wait for everybody to get vaccinated, because I think that will really cut down on the fear that I have of just shutting everything down. Bethlehem Emergency Shelter is threatening to shut their shelter down because they're so, right now that half of their group is in quarantine getting tested. And that's only those that fessed up to it. So I think we're at the brink of just kind of craziness again, because I think it's not a great system. It really relies on honesty and people not being desperate. And when you're outside, especially in this 9-degree weather, people are going to lie, and I would too.
It's also got to be difficult to get volunteers to help too.
Absolutely. That's the reason why the Allentown Y shut prematurely last year, because they didn't have the volunteers were said, I'm sorry, we're not getting paid for this. And a lot of the volunteers were elderly, so they were high risk to begin with. And so it's asking a lot of people when it's something we don't really understand. So I totally get it. And so I don't think anyone's faulting anybody for, in fact, I did say to the Y last year, and I didn't want to say this to Mint directly, but I said, I did eventually fess up to this, but I said, honestly, you shutting the shelter early probably saved lives, because it meant people were having to survive outside, and our outside folks actually didn't get COVID, but it's a miserable existence. But it's the inside folks, it's the sheltered homeless that were getting COVID, not the unsheltered. To date, no unsheltered, in almost a year, no unsheltered persons have gotten COVID, only the sheltered. So that says a lot for isolation and for the fresh air of being outside, because our folks are not getting it that are living outside, just the ones that are inside. So it says a lot, right?
Yeah. The other question I had was, what kind of social work, as far as helping them get employment, does that go on very often? And like places like CareerLink, do they help at all?
Yes, but CareerLink has to be open. During COVID, they haven't been open. And so they do virtual interviews, but our folks don't have phones. So it's really hard. It's really hard. And so it's a great idea, and everything is done virtually. And so I had to kind of chastise the hospital. And again, they're my employer, so I have to be careful how I chastise them. But everybody was patting themselves on the back about all the virtual visits they had and all the COVID screenings and all the virtual everything. And I was like, that's great, but you have to have a phone You also have to have Wi-Fi, and you have to have enough minutes to work that phone. And so that does nothing for our folks. And so I have to, even those that have phone only have it when they're in Wi-Fi, and they certainly don't have enough minutes. And so, and they're not in Wi-Fi because the library closed, which is where they got Wi-Fi. And that's where they used to stay warm. And so all the places that they used to stay warm, like the soup kitchens had Wi-Fi that was free. All the soup kitchens are still doing to-go meals. So they don't even have a place to go in and get warm. And so they're really having a tough time. So it's really kind of brutal for folks. But, you know, they're way better survivors than I am, to be honest. I'm really proud of them because you throw me out there and I'd be a blubbering mess. And so I think I'm really very much in awe of their survival skills, because I get to go into a warm car at the end of the day and turn on my little seat warmers so that my buns are warm, and they don't get to do any of that. So I think I'm really in awe of their survival. And if there's an apocalypse, I tell you, I'm going to go hang out with them because they know how to do it.
Sounds good. It sounds like you should be the type of person that gets called to Washington to testify, to tell the government what we really need.
I'd probably be fired, but I'd love to do that. You know, I mean, I definitely have gotten in trouble with my administrators at the hospital because I don't know how to shut up. But I feel that, but in the defense of our administrator, Dr. Nestor, our CEO, he actually comes out every quarter on rounds with us. So he comes outside and he walks those streets with us. The president of the hospital walks the street with us. Oh, thank you, Julie. I do remember it's being recorded. Oh dear, I just got myself in trouble. But yes, thank you for the gentle reminder. But I have to say, like I said, Dr. Kent, Dr. Nestor, they all go out on rounds with us. And so I think that says a lot for an administration who gets to know our patients and they get to know the bridges. I've had the mayor of Bethlehem go out with me. I've had the mayor of Allentown go out with me. And so I think we have people that are aware. It's just, I think sometimes the problem seems so big. Like, what do we do? And so I think sometimes it just means starting small and supporting programs that we can hang on to. And so I think that's the stuff that I think about. I think about respite care, where we need, help like that. And I think about survival supplies. And so I think sometimes until we get the bigger upstream answer, I think this is a really great, and just having people listen. So I appreciate you guys taking the time to listen to something that's very difficult that's going on in our own community. So kudos to you for actually even bringing this to people's attention. So
I think it's something important for us to know, as the League of Women Voters, we kind of look after and try to protect our democracy, but that democracy is full of people. So it's really nice to know who needs more services and how we're kind of not getting the services we need to all the people that we need. So that's part of our mission too, I think. Yeah. So does anyone else have any questions? Okay, Pat, Swan.
Yeah, I would like to know, you mentioned 2 teams. How many people are in a team? Or
that's a great question. There's 8 of us, and I just hired 2. So there's just myself and one other provider, Seth. So we only have 2 providers for the whole Lehigh Valley. And so we split up into 2 teams. So 1 provider per team. I have no full-time nurses yet. I have 2 per diem nurses. I have 1 community health worker. I have 1 site director. I have 1 patient service representative, and a 1 hour, and then I have a medical director that doesn't necessarily come out on rounds with us all the time, but we have 8 full-time persons that do this work.
Okay, and do you feel safe going under bridges and all these places?
Great question, always. And our patients are our best advocates, and they're the ones that look out for us. And so they'll say, Nani, don't bother going over there. Like, they're a bunch of losers, or they're a bunch of druggies, and so it's really great. Like, they really do protect us, and they make sure that and they spread the word that we're coming so that people know that we're coming. And so our patients look out for us, and I've never felt unsafe. Always felt welcome.
Okay, and now that young woman that was pregnant, what was going to happen to her? Where would she have her baby? How, and could she live out there with a tiny baby? What would happen?
She just had her baby 2 weeks ago, and Children and Youth had the baby adopted. So she actually had made plans with some parents to adopt the baby. And so that was something she knew that was going to happen. So she'd kind of made plans with a couple, and so that's what happened. So she is now back under the bridge, but her baby has been adopted to a lovely couple.
Safe place. So what is the range of age? I mean, are they sort of 20s, 30s, 40s?
The youngest that I've taken care of this year so far is 16, and then the oldest 82.
Okay. So
and that's my mother's age. So that actually like breaks my heart. I couldn't imagine my mother living outside.
But that person has survived well past the age that you mentioned before.
Yep.
I'll vouch for the people. They are so willing to help. Like when we would do the meals for them, they would help clean up. They'd offer to do everything. They would be so thankful. Mm-hmm. But another issue that has happened, and we hear stories of them, of course, people they'd get into fights with and whatever, but several of them would come in and say the Bethlehem police had raided their encampments and taken all their tents and all their supplies and everything. How do we deal with that? I know people feel uncomfortable walking on Sand Island because there are encampments along there and stuff, but to have the police confiscate all the stuff that has been donated to them or they managed to cobble together seems very disturbing.
I think it just has to do with the relationship that you have with law enforcement, and that's the thing that's hard. We had a great relationship, but if the owner of the property wants people off their property, then he or she might enlist the law enforcement to remove people off their property. And so I think the police are willing to look the other way as long as there's no complaint. And that's so I think we've worked really well with both Bethlehem and Allentown. So they tend to look the other way unless somebody says there's a complaint that says like, I want those people off my land, then they have to go in. And so, but I think for almost 5 years, the Allentown police looked the other way with the largest encampment in Allentown near the Parkettes. And finally, some new owners bought it and said, everybody needs to be off. And so November 1st, everybody had to be off the property. And so they went through and they cleared everything out. But that's because that was mandated by the owner. So if the owner looks the other way, then I think people tend to not care. But I think if an owner says, I don't want folks like that living on my property for free, then the police will be forced to actually move people and destroy things so that people don't come back.
But I mean, some of these encampments are under the bridges and stuff, which is, I presume, public property.
Every once in a while, they'll clear out an area. So Hamilton Bridge has been cleared out several times since I've been doing this. And then little by little, people start making their way back until there's enough people that kind of raise the flag, and then the police will go back under again and say, and they usually the city will give us some warning. They'll say, Nani, we're going to go in there in a couple weeks and, put a notice up that people are trespassing. So they'll usually give us some warning so that we can go in and try to scoot people along. But because there's no places for people to go, oftentimes people will just hang on for the last minute till they get forced out. And so I've really had really good relationships with law enforcement. They've been pretty good about just kind of looking the other way unless their hand is forced.
Okay, any more questions, Barb? We'll make
one more. Are the school districts involved with those homeless that are minors? You said the youngest was a 16-year-old.
Yes, we work really closely with Valley Youth House. which is, and we have a clinic there at the shelter for youth. So that's for 12 to 17 years old. And so we work very closely with Valley Youth House, and the Allentown School District has a homeless liaison who we work closely with also. So really great community partners out there doing work for minors as well.
Okay, that's great.
That's good. Well, I think we've taken up a lot of your time, and I'm sure you're very, very busy. Your presentation was very compassionate and very moving. We can see that you love what you do, and we're glad you're doing it. So if we have no other questions, I'm going to turn this over to Molly now. And thank you, Nani, for taking the time out to explain to us about the street program. And I think there's a lot of us that are thinking, what can we do to help? And I'm sure we'll talk after this presentation. So
Many thanks for your interest, and you guys have a lovely, warm evening.
You too.
Take care.
Stay safe. And
Bye-bye.
I'll turn it over to Molly.
And thank you.
Yes,
You're welcome. Thank you.
Myself here. Thank you, Nani. We appreciated all that you told us. I just wanted you to know, the members that are still here, that we had a successful and well-attended running for local office workshop on January 30th. Of course, people have met in person in past years, and this is the first time we've done it in a virtual format. It was a feat which required a lot of planning and organization, and the committee that put that together did a really superb job. And there will be more information on it in the next voter that comes out at the end of February. I also wanted to let you know this is a time of legislative interviews. State sends out a questionnaire for us to talk to our local state legislator. And the responses that we get are sent back to the state league office, who will use them for determining how the lobbying effort will go. So contact me if you're interested in participating in this, and I will send out an email looking for volunteers. It's always better if your own legislator is the one that you talk to. Our next hot topic speaker will be Chris Borick on climate change, opinion and policy. And the date is March 8th of next month. So I hope to see you there. Keep warm, keep safe, have a good rest of the day.
Thank you, everyone. Thanks, Terry.
Thanks, Terry.
Thank you.
Okay, everybody stay safe. Hope you get vaccinated.
And stay warm. Yes, I hope so too. Bye.